Welcome and thank you for joining us here today for Dr. David Brownstein's exciting video documentary presentation, The Unknown Shocking Epidemic, 52 Million Americans, 59 Debilitating Diseases, and Your One Tiny Thyroid. Here's why the truth about your tiny thyroid gland is so very shocking, and why you need to watch this presentation all the way through. First of all, 52 million Americans suffer from a thyroid condition, and most of them don't even know it. But the real question is this: could you be one of those 52 million? Unfortunately, this group of 52 million also includes untold people who've been reassured by their own doctor that their thyroid is normal. You'll soon discover why you can't necessarily believe your doctor when it comes to your thyroid health. And if you already know you have a thyroid condition, you'll see how to reverse it much more effectively and avoid potentially serious health complications. Now, you may have heard that thyroid problems mainly affect middle-aged women, but today you'll see how children and adult males experience thyroid illness too. And here's the biggest shocker of all. Thyroid problems have been linked to 59 different diseases, like heart disease, cancer, obesity, and diabetes, just to name a few. But first things first, who is Dr. Brownstein and why should you listen to him? Well, Dr. David Brownstein is a board-certified family physician, author, and guest lecturer. He's also medical editor of the popular Newsmax newsletter, Dr. Brownstein's Natural Way to Health. While he started out as most MDs do with the conventional medical model, he quickly realized its shortcomings. So he plunged full speed ahead into alternative medicine and began to use the best of both conventional and holistic therapies in his medical practice. As you'll see momentarily, his very first thyroid patient was actually his father, Ellis. Solving his father's thyroid illness put Dr. Brownstein on a 25-year quest to learn everything he could about the importance of your thyroid to overall health. And today he will share with you during this free video report the very same strategies he used to heal his own father and countless other patients as well. In fact, Dr. Brownstein has become one of America's foremost authorities on thyroid health. Without further ado, let's go down to the Newsmax studio and join Dr. Brownstein for his presentation, The Unknown Shocking Epidemic, 52 million Americans, 59 debilitating diseases, and your one tiny thyroid.
Hi, I'm Dr. David Brownstein. I'm a family practitioner from Michigan, and I've been practicing holistic medicine for over 20 years. In today's talk, I will discuss with you the prevalence of thyroid problems and why it's affecting so many Americans and what you can do about it. I will show you that up to 60 to 80% of Americans are currently suffering from an undiagnosed abnormal thyroid function. I will show you that thyroid dysfunction is the #1 cause of heart disease, and it's the major cause of arthritis, cancer, and many other chronic ailments that is not currently being diagnosed. I'd like to show you what undiagnosed hypothyroidism can do. This is Laura, and Laura's mom brought her to me because Laura was irritable and not playing, and she was cold in the summertime. And you can see in this picture that she's got these black shiners under her eyes, her hair's sitting lifelessly on her head, and Laura's mom was being treated by me for hypothyroidism. Laura had normal thyroid blood tests, she had a low basal body temperature, she met every clinical sign to diagnose low thyroid, and I gave her a therapeutic trial of thyroid hormone. And here's the results in Laura, 6 months later. You can see she lost the allergic shiners under her eyes, her hair became back to normal, and most importantly, she became more active and became her normal self again. I will show you during this talk that undiagnosed hypothyroidism can have serious consequences in people, not only from children to adults. And here's a picture of Laura today. This is my book, Overcoming Thyroid Disorders. It was one of the first books that I wrote many years ago, and it's currently in its 2nd edition. And I wrote this book because I started seeing so many patients with thyroid problems that were not being diagnosed by their doctors and patients suffering from this illness. My first patient was my father. My father suffered his first heart attack at age 40, his second heart attack at 42. My father had seen many doctors and had undergone 2 bypass surgeries and many angioplasties. He was on a whole host of medications by the time I'd finished medical school and my residency. And at that time, he truly looked like he was going to die. Now, I had learned in medical school that the way to diagnose thyroid problems was to take a blood test, and particularly a TSH blood test. And if that blood test was abnormal, then you give the patient a prescription for thyroid hormone. What I've learned now is a TSH test does not pick it up in many patients, and it certainly didn't pick it up in my father. And when I performed a holistic evaluation on him, I found that he was suffering from an undiagnosed thyroid problem. And I also learned that an undiagnosed thyroid problem could explain his chronic heart disease progression. When I treated my father for his thyroid problem, his 25-year history of angina went away in 7 days, never to return. He looked better, he acted better, he lost 20 pounds of weight without changing his diet and his habits, and more importantly, he didn't look like he was going to die. And really, that was my first patient, and that set me on my quest to diagnose and treat and to educate people about thyroid problems and what they can do about thyroid problems in their lives. I'd like to start off with a quote. The superior physician helps before the early budding of the disease. The inferior physician begins to help when the disease is already developed. This quote was written thousands of years ago, and it really speaks to the heart of holistic medicine. In conventional medicine, and what I was taught in medical school was to diagnose pathology and to use a drug to treat that pathology. But by the time you diagnose the pathology, the disease is already there. What I try and do in holistic medicine is to recognize the signs of dysfunction in the body and to treat that before pathology develops. And that's what we'll talk about today, particularly with thyroid problems. Now, this is my collection of books that I've written. I've written 9 books so far, and we're going to focus on overcoming thyroid disorders today. Now, this quote was written 35 years ago, and it was from one of my mentors in thyroid problems, Dr. Brodo Barnes. And he wrote that 40% of American people, 4 out of every 10 children and adults today, are suffering needlessly, and many are dying from lack of an ingredient vital for health. Is the ingredient unknown? No. Or unavailable? No. For years, medicine has recognized the role of the deficiency in some areas of health and disease and has had clues to its great importance in many other areas. But the knowledge has often not been used and still is not being used because of the unreliability of laboratory tests that have failed to show the deficiency, even when doctors could see its manifestations clearly enough in patients before them. And while lab tests have erred and have misled both doctors and patients have suffered. Unfortunately, this quote is still true today, 35 years later. Doctors are still misdiagnosing thyroid problems or not diagnosing thyroid problems because they're relying on unreliable lab tests. These are the chapters in my book that we'll talk about today, and we will cover these disorders, and I will give you practical tips on how you can help improve a thyroid problem. We'll focus on hypothyroidism, and you need to know that thyroid hormone affects every cell in the body, and that you can't achieve your optimal health without a properly functioning thyroid gland. And I believe hypothyroidism, or an underactive thyroid, is the most commonly misdiagnosis today, and upwards of 60 to maybe 80% of the population may have an undiagnosed abnormal thyroid problem and may have undiagnosed hypothyroidism. The way I describe it to my patients is that every cell in the body has a little machine in it, and that machine is driven by thyroid hormone. And you can visualize that like a piston turning. When there's enough thyroid hormone, that piston turns at the appropriate rate and gives off enough heat, and people feel good and have enough energy. When there's not enough thyroid hormone, that piston is very sluggish. People are cold, they're tired, they're gaining weight, they have dry skin, headaches, migraine headaches. We'll talk about all that during this talk. So this is the pathway we'll talk about. The thyroid gland sits in the lower part of the neck. It weighs about 1.5 ounces and produces a teaspoon of thyroid hormone for a whole year. This teaspoon of thyroid hormone has to drive the metabolic rate of every single cell in the body 24 hours a day, 7 days a week. When I lecture to physicians, this is the pathway that I discuss with them. And the thyroid gland releases a hormone called T4. T4 goes into the bloodstream and gets converted to T3 inside the cells of the body. And T3 is what has the effects on the body. It's what drives those pistons. It's what gives people energy, heat, and makes them feel better. This is the pathway we want to optimize. Now, when the thyroid gland gets out of balance, it pulls all the other endocrine glands out of balance. And these are a list of who's who of who's not feeling well out there when their hormonal system is imbalanced. You can have allergies and anxiety and arthritis and cancer, candida, chronic fatigue, fibromyalgia. I won't go through this whole list, and we'll cover most of this during the talk. But needless to say, every cell in the body is not going to function normally if there's not enough thyroid hormone.
Wow, Dr. Brownstein is really over-delivering, isn't he? You've already discovered how 60 to 80% of Americans suffer from undiagnosed abnormal thyroid function, and how this is the #1 cause of heart disease and a major cause of arthritis, cancer, depression, and many other major illnesses. Plus how hypothyroidism is the most commonly missed diagnosis today. Now, one thing you should know is that we had to condense this presentation down from this live format. But don't worry, you can get a free DVD containing the 100% complete and uncut version of Dr. Brownstein's presentation with this special offer you'll see in just a few minutes. So keep watching. And to let you know what's coming up, in just seconds you'll see what your tongue says about your thyroid. The actual tongue photo you'll see may astonish you. 24 symptoms that could indicate you have low thyroid function, even if your TSH blood test comes back normal. Lab tests you must ask your doctor to run if you suspect you could have a thyroid problem. How to check your thyroid from the cozy comfort of your own bed, and a bit later you'll discover easy and effective ways to supplement your thyroid function if you find it needs a little help. How your thyroid could actually be responsible for your weight gain, especially important if you haven't been able to lose weight no matter what you've tried. If you have fatigue or brain fog, could your thyroid be the culprit? And much more. So let's rejoin Dr. Brownstein with his dynamic thyroid presentation right now.
So, if I say the blood tests don't pick it up, how do I do it? Well, one of the first things I do is take a history on patients. And these are some of the things that I look for on a history. I look for if a patient is suffering from acne or any arthritic condition, atherosclerosis, constipation, if they had cold extremities, cold hands and cold feet, if they have decreased hearing, depression, eczema, fatigue, particularly morning fatigue, if they suffer from headaches or migraine headaches, hypercholesterol or high cholesterol, hypertension or hypotension can be related to low thyroid. Infertility is particularly related to low thyroid function. I've treated many patients over the years for infertility issues, and it's solely related to low thyroid function. Julie is a patient of mine, and Julie came to me complaining that she was tired and cold, and she was having headaches, and she wasn't thinking clearly, and she was 30 years old, but her big problem was she was infertile, and she couldn't get pregnant. She had gone through GIFT and ZIFT and spent thousands of dollars trying to get pregnant, and when I saw her, she met every criteria to diagnose low thyroid, except her blood test was normal. Her basal body temperatures, which I'll discuss with you in a minute, were very low, showing a low thyroid function. And when I treated her with a small amount of thyroid hormone, not only did her hypothyroid symptoms get better, but she magically got pregnant 2 months later. And to this point, Julie is still taking her thyroid hormone, and I've treated many patients like Julie over the years. Mental impairment, menstrual disorders such as heavy bleeding and bad PMS symptoms can be related to low thyroid. Ovarian cysts can be related to low thyroid. Poor memory, psoriasis, recurrent infections, slowed movements, and voice changes can be related to low thyroid. These are all the signs that I look for on my patients when I take a history from them. Now, not only do I do a history, I do what I was taught in medical school. You do a physical exam. And these are some of the things on physical exam that I look for my patients. Are they anemic? Do they have dry skin? Do they have swelling? Particularly swelling under the eyes, and I'll show you some slides of some patients that have that. Do they have a goiter or swelling of the thyroid in the neck? Do they have hair loss, particularly hair loss in the front of the head? Do they have hypertension or hypotension? Macroglossia means a swollen tongue. I'll show you a picture of a swollen tongue. Do they have periorbital edema, which is swelling under the eyes? Poor eyebrow growth, especially the outer third of the eyebrows, fades away. It's known as the sign of Hertog, and that was written about in the late 1800s. It's related to low thyroid. Do they have a puffy face in general? And they can have sluggish reflexes. These are all the physical exam signs that I look for on a patient that I might suspect has low thyroid. But also, I will look for their tongue swelling. And here's a picture of a patient with their tongue swelling. And what you can see is on the outer edges of the tongue, there's little grooves in that where the tongue is banging into the teeth because it's too big for the mouth. Many times patients will tell me that their tongue feels too big for their mouth and they're tripping over it as they're trying to talk. All this goes away when you treat them appropriately with thyroid hormone. Now, this was an interesting study that found that the biggest difference between thyroid and non-thyroid patients were ankle reflex being slow, slow reflexes, dry skin, coarse skin, puffiness, constipation, and slow movements. These were the major differences between people who had thyroid problems and people who didn't have thyroid problems. And these are what I look for in my patients. Now, I also do lab tests. I mentioned to you that I didn't think the lab tests were the most appropriate way to diagnose someone with a thyroid problem, but they should be part of a diagnosis paradigm. So I check TSH, I check T4 levels, I check T3 levels, I check reverse T3 levels, and I check thyroid antibody levels. I also do 24-hour urine testing occasionally. Every thyroid patient deserves a serum ferritin level, which measures the iron level in the body, and they deserve a serum B12 level. Now, I've been telling you that the diagnosis of hypothyroidism is much more than a TSH test. You need to take a history, you need to do a physical exam, and you need to do other blood tests. But one of the crucial monitors for thyroid function is the basal body temperature. The basal body temperature is the first morning temperature that your body has while you're lying in bed before you get up. The way you do it is on this slide. You can have a thermometer at your bedside and put it under your arm or in your mouth if you don't have a cold or a flu symptom. and you take the morning temperature. Menstruating women should take their temperature on days 2 to 4 of their cycle, and a normal underarm temperature is 97.8 to 98.2 degrees Fahrenheit, and a normal oral temperature is a degree higher than that, 98.8 to 99.2 degrees. A lower temperature would signify that those pistons are not running normally and giving off heat, and people's bodies are cold, and would signify a low thyroid function. I have many of my patients take basal body temperatures on a routine basis and bring them into me, and I use that as part of my diagnostic capabilities. A holistic way to diagnose a problem that can affect every single cell in the body from head to toe is take a history, looking for the signs of thyroid illness, do an appropriate physical exam, check basal body temperatures, and do the appropriate blood tests, and put the whole picture together. It's much more than just spending 5 minutes with someone and checking a TSH level.
I hope you're enjoying this eye-opening video documentary presentation on the unknown shocking epidemic of thyroid disease, and I'd like to thank Dr. Brownstein for graciously offering to provide this to you at no charge. Now, I previously told you that you'd have the opportunity to receive a copy of the full-length DVD of this presentation. You'll get it in its entirety with all the deleted scenes, Dr. Brownstein's exhaustive research, and much more information that could literally save your life. And it's free with our very special offer. What I didn't tell you until now is that you'll also receive a free copy of Dr. Brownstein's book, Overcoming Thyroid Disorders, a $20 value. You've heard him mention this book several times during this video report. You'll receive both these items free when you agree to try out Dr. Brownstein's Natural Way to Health for just pennies a day. In this monthly health advisory, you'll see the excellent results Dr. Brownstein has been getting for his patients, many of whom were at the end of their rope using only conventional treatment. You'll get more details about this special offer shortly, so stick with us. Now let's rejoin Dr. Brownstein as he shares even more little-known thyroid facts that could impact your health and the lives of your loved ones.
The problem with just treating TSH tests is you can let low thyroid disease go on, and patients aren't being treated, and eventually they can develop serious illnesses like thyroid cancer, which is occurring at epidemic rates right now. If you're hearing from your doctor that your thyroid's normal, yet you have every sign and symptom to meet the diagnosis of low thyroid, and they're just checking a TSH level, my suggestion to you is to find another doctor that's going to look at you as more than just a TSH level. Here's another quote from the peer-reviewed literature. We should acknowledge that TSH is not a good indicator of the adequacy of thyroid replacement. We should prescribe sufficient thyroxine to restore the patient to clinical euthyroid state while maintaining T3 within the reference range. What they're saying is don't just rely on a TSH level. Now, prior to the TSH levels, doctors would treat patients clinically. They would do a history, they would do a physical exam, and they would make a clinical decision whether they thought they had a thyroid problem. And their standard thyroxine replacement doses range from 200 to 300 micrograms per day. That's the same thing as Synthroid or Levothyroid. In 1971, there was a first report on the measurement of TSH tests in a patient on thyroxine replacement. And from that point on, doctors primarily began using the TSH test solely. Now, they reported that the serum TSH returned to normal with 100 to 150 micrograms per day of thyroxine. This was an immediate 50% reduction in dosage. So as soon as we started relying on the TSH to diagnose someone as having a thyroid problem or not, we reduced the amount of thyroid hormone we were giving to patients by half. And I think the consequences of that now are ongoing atherosclerosis as the #1 killer, cancer, arthritis, and a whole host of other chronic illnesses related to low thyroid function. In this study, women increased by 2.3 kilograms, which is about 4.5 pounds for every 1 unit increment in TSH concentration within the normal range. Men increased their weight by about 2 pounds for every 1 unit increment in TSH concentrations. And the author summarized the study by saying the change in serum TSH concentrations over time within the reference range was strongly and linearly associated with weight gain. Alzheimer's disease is also related to thyroid function. In this study, 209 participants, 12.7 years of follow-up, women with the lowest and the highest serum TSH concentrations had increased risk of Alzheimer's disease compared to those in the middle quartile from 0.5 to 2.1. In the lowest tertile, a 239% increase, and the highest, a 215% increase. Alzheimer's disease, another epidemic disease right now, and it's a hormonal and nutritional imbalance syndrome that's not going to be treated correctly with drugs. It needs to be treated with a holistic approach, and one of those approaches is to balance the thyroid gland.
By now, you already know more about your thyroid than most people in America do. And you're getting some easy-to-do tips, too. In fact, I think I'll go home and check my own basal body temperature, and I hope you do, too. especially when your thyroid can be responsible for gaining weight. If you've been packing on those annoying extra pounds, your thyroid might be an issue to consider. Wouldn't you agree? And don't forget, what you're seeing is only a fraction of what you'll receive in the full-length uncut version of Dr. Brownstein's video, one you can get at no charge with a special offer we've arranged for you, just for watching this presentation. Now, I just want to give you a heads up, a little early notice. You should be aware that we have 8 million Newsmax readers and only 2,000 copies of Dr. Brownstein's video presentations and books in stock right now. I know they'll be flying off the shelves today in just minutes following this presentation. Just so you know what to expect, later in this video, you'll have a special opportunity to get your own free gifts, including the complete DVD and Dr. Brownstein's book when you try out Dr. Brownstein's popular Natural Way to Health newsletter for only pennies a day. I have some other gifts arranged for you as well, so don't go away. Now let's rejoin Dr. Brownstein as he'll be telling you what you must know about thyroid supplementation that actually works and why the most commonly prescribed thyroid medication may not be enough.
Now, if you're diagnosed with a thyroid problem, you're confronted with what kind of thyroid medication to take. The conventional way to treat thyroid medications is to use levothyroxine sodium, Synthroid and Levothyroid. That's that T4 on this slide. However, many people need more than just T4 to get their thyroid to work correctly. Desiccated thyroid is what I use in my practice on a lot of patients, and that's a natural porcine-derived thyroid. It has T4, but it also has other thyroid hormone like T3, T2, and T1. It has calcitonin, selenium, it has a diuretic effect. And most importantly, for many patients who are nutritionally depleted or have been suffering from a long time, they need the desiccated thyroid over the levothyroxine sodium products. Now, there's other thyroid hormone choices. The desiccated thyroid choices include Nature Thyroid and Westhroid. These are corn-free desiccated thyroid hormone from natural sources. There's compounded desiccated thyroid hormone where you don't have any fillers and you can adjust the dosages very tightly. Compounded T3, there's many different choices out there for patients suffering from thyroid problems. And a doctor skilled in diagnosing and treating thyroid problems can help you navigate these pathways. When I start with thyroid treatment, I start low. For adults, I'll start at 1/2 grain of desiccated thyroid hormone and titrate their dose depending on their symptoms and their lab tests and seeing them back. For those who are elderly or heart disease history, I start smaller and go slower. But all the while, I monitor patients' basal temperatures, lab work, physical exam signs, and symptoms. That's a holistic way to treat someone for a problem that can affect every single cell in the body. Now, I'd like to show you some pictures of some patients and their response to thyroid treatment. First picture I'll show you is Carol. Carol was 30 years old here. She was a school teacher working full-time, was playing tennis 5 to 7 days a week, working out, in good shape, feeling good, became pregnant, and around 3 to 4 weeks of pregnancy started to not feel well and gain a lot of weight. By her 5th month of pregnancy, she was put on bed rest due to abnormal weight gain and her blood pressure was going up. Carol gained 100 pounds during her pregnancy. In this picture was a picture of Carol 6 months after she delivered. At this point, Carol was unable to take care of her newborn baby. Her husband, Todd, was having to stay home and take care of the baby with her. She didn't feel good. She couldn't go back to work. She was tired all the time. Carol was eating a good diet. Carol was taking nutritional supplements. And when she came to me, I was struck by her appearance and how hypothyroid she looked. What I was looking at was her eyes were almost swollen shut because she has so much fluid in her face, and she had lost her hair on the front part of her forehead. Carol had normal thyroid blood tests. She had a basal body temperature that was 2 degrees below normal. And Carol met every sign and symptom to make the diagnosis of low thyroid. She was tired, she was cold, she was constipated, her hair was falling out, she had dry skin, and many other symptoms. I elected to give Carol a therapeutic trial of thyroid hormone. And here's a picture of Carol 6 months later. Now you can certainly see she lost the weight in her face, and her hair became back to life. More importantly, she began to feel better, was able to take care of the baby, went back to playing tennis 5 to 7 days a week, and was feeling her normal self. And this is one response of a patient with a normal thyroid blood test. So in Carol's case, clearly the thyroid blood test did not pick up what was wrong with her.
Wow, those before and after photos of Carol are dramatic and shocking, aren't they? Carol gained so much weight and had so many classic signs and symptoms of hypothyroidism, even though her lab test showed her thyroid was normal. This is a great example of how those medical tests can be flat out wrong. Just imagine how many people could lose weight if they only knew more about their thyroid. Your thyroid health is such a crucial issue today. That's why we want to get these materials into your hands right away. The full-length DVD, Dr. Brownstein's book, Overcoming Thyroid Disorders, and several other gifts I'll tell you about shortly, can soon be yours free with this special offer. So watch for a big orange button to pop up. That's the time for you to claim your gifts. Now let's get back to Dr. Brownstein as he shares with you how your thyroid can contribute to common problems like fatigue and that brain fog feeling. Plus, if you have children or grandchildren, you'll really want to see this.
Here's another patient. His name is Alec. And this was Alec before I saw him, and I asked Mom to bring this picture of Alec to me. And clearly from this picture you can see that he's swollen under his eyes and he's puffy here. And Alec is about 6 months old in this picture. And this was Alec when I first saw him in the office. And when I walked in to see Alec in the office, I had the chart in one hand and I had my hand on the doorknob. And as I opened the door and saw him there, I paused at the opening. I didn't introduce myself to the parents because I was struck by his appearance. And I blurted out, "He's myxedemic." That was the first words that I said to the parents. And the mother said, "What's that mean?" And I said, "He's severely hypothyroid." And she said, "No, he's not." And she's flipping through papers. And she gave me thyroid blood tests and said, "We just had his thyroid levels checked. They were normal." What I was struck with was that Alec was sitting in that wheelchair. His face was all puffy and swollen under his eyes. And his tongue was big and swollen and hanging out of his mouth to the side, and he was drooling. Alec also had puffiness on his wrists. Well, when I checked Alec out, he had very slow reflexes. He was constipated, he was cold, his skin was dry. Alec was also having seizure disorders from being a cerebral palsy baby, and he was on 3 seizure medications at high doses. Alec had normal thyroid blood tests, he had low basal body temperatures, he had many signs and symptoms to meet the diagnosis of low thyroid, and I elected to give him a therapeutic trial of thyroid hormone. And here's a picture of Alex 3 months later. And 3 months later, you can see that he loses the swelling under his eyes, his tongue receded back into his mouth, his hair came to life. And these are the responses that I see in my patients on a daily basis. Another important factor that happened with Alec was that his seizures went down markedly. He went from 3 seizure medications at high dose to 1 seizure medication at half dose. He went from having 20 to 30 seizures a week at full dose to having 1 to 3 mild seizures a week at this small dose of medications. And this is a picture of Alec before and after. This is a picture of Alec now. So again, here's another case of a patient with normal thyroid blood tests who clearly could meet every clinical sign to make the diagnosis of hypothyroidism. These are more than just TSH patients. This is Dawson. I was taking care of Dawson's mom for thyroid problems, and she wrote me this email, and I'd like to read it to you. "I thought you'd like to see Dawson's latest report card and comments. He used to be reserved and did not want to interact socially. He has been on Armour Thyroid for 6 weeks now, and the teacher has noticed that he has changed in personality and attentiveness. Maybe all the kids being diagnosed ADD and ADHD are really hypothyroid. I'm so thankful that he had help available to him. My mom commented on Easter that my kids were like 2 different children. I agree. Dawson could not sit at his chair at mealtime. He was up and down and up and down. It drove us crazy. Now he sits through the entire meal and eats. I've not heard that his stomach hurts, which used to be every night, since the first week he was on thyroid meds. I no longer worry about my babies. They are doing so well." Now, Dawson was doing fine on his thyroid hormone until I got another email from his mother saying all his symptoms were back. And in the email she said he didn't do well on a spelling test, and she knew he knew the words beforehand. And she emailed the spelling test to me. And here's Dawson's spelling test. And you can see that, well, he may have a doctor's handwriting, but it's all over the place. He's got some alien drawings down here, and he's missed a bunch of the words. Well, the mother said that he was up and down again, and his basal temperature had fallen again, and she thought he had reversed his symptoms. I asked her, "Is he in a growth spurt?" And the mother said yes, his pants were short on him, and he was in the middle of a growth spurt. So we upped his thyroid medication a little bit, by 1/4 of a grain. The mother had asked the teacher 10 days later to repeat the spelling test because Dawson was doing much better and all his symptoms were better controlled. And here's what happens when you get the thyroid hormone correct. His spelling test 10 days later, without preparing with his mother for this, looked like this. And you can see his handwriting improved. There was no alien drawings. He got most of the words correct at that time. And this just shows the brain dysfunction that can occur when thyroid hormone is not normal. And for those of you suffering with thyroid function, I don't have to tell you that you're feeling brain fogged and fatigued and you can't think clearly. But again, there is a cure for this, and it's getting the thyroid gland corrected. This was a report card from Dawson's teacher saying how much better he was doing. So why do blood tests miss it in many patients? Well, this is these chapters I cover in my book, Thyroid Hormone Resistance and Poor T4 Converters. And here's the pathway again. The thyroid gland releases T4, T4 should convert to T3, and T3 should get into the cells and have the effects on the body. However, if there's a block between T3 and getting into the cells of the body, patients can have normal thyroid blood tests yet feel terrible. And that's why the blood tests can miss it. And that's what I see in the vast majority of my patients. This has been reported in the literature since 1967. It can occur with adequate production of thyroid hormone. I say it's analogous to adult onset diabetes, where many of these patients produce enough insulin or sometimes too much insulin, yet they still have diabetes. In either case, the laboratory tests are inaccurate for thyroid problem, just as a laboratory test to check for insulin levels are inaccurate for diagnosing diabetes. Again, this is the pathway that we want to emphasize and to normalize. When I'm lecturing to physicians, I'm showing this pathway over and over in my lecture, saying this is what you want to focus on. Now you can also have a T4 conversion block. So in this pathway, you can see the thyroid produces enough T4, yet some, most, or all of T4 is not converted into T3, and most importantly, patients don't feel well. They have symptoms of hypothyroidism. In this case, the TSH will be normal, yet they will still have symptoms of hypothyroidism. This has been reported in the medical literature, and here's one study of lowered T3 levels in the elderly associated with lowered attention, depression, increased mortality, and lowered ability to perform activities of daily living. Again, in this study, they had normal TSH levels. Now, thyroid hormone levels in cardiac tissue and iodine deficiency were looked at. Iodine deficiency in rats resulted in a subclinical hypothyroid picture, a slightly elevated TSH, but normal T4 and T3. And despite normal T3 levels, cardiac tissue was found to be deficient in T3. T4 therapy, that's Synthroid or Levothyroid, was unable to correct the cardiac deficiency in the presence of iodine deficiency. What the authors are saying is, it's not just thyroid hormone that needs to be treated in hypothyroidism in many patients. You need to treat the underlying cause of this, which in many cases is iodine deficiency. My book, Iodine, Why You Need It, Why You Can't Live Without It, goes into this in much more detail.
This problem about the block in the conversion of T4 to T3 is something Dr. Brownstein will tell you more about on the full-length DVD. It's a crucial issue as you grow older, since it can result in depression, difficulty performing simple activities of daily living, even an increased risk of death for those of us over 55. Dr. Brownstein tested over 5,000 of his own patients and found that 95% of them were iodine deficient. And in his decades of medical practice, he has learned that iodine is the single most important nutrient for preventing multiple illnesses, including heart disease. And that's only the tip of the iceberg. Speaking of iodine, Dr. Brownstein just showed you his book, Iodine, Why You Need It, Why You Can't Live Without It. The topic of iodine is also a critical piece of the thyroid puzzle. So we're going to give you not one free book, but two with our special offer, delivered right to your door. We're going to throw in a copy of Dr. Brownstein's book, Iodine, Why You Need It, Why You Can't Live Without It, free, along with another free gift, his companion full-length DVD presentation on iodine deficiency. In your bonus book and DVD on iodine, you'll see how the ticking time bomb of iodine deficiency can lead to multiple types of cancer, plus heart disease, obesity, and many other medical disasters. And you'll also discover the little-known connection between low iodine and elevated bad cholesterol. In fact, you'll learn that while millions of Americans are taking dangerous statin drugs to lower their cholesterol, many of them could be helped with just a few drops of nutritious iodine. Plus, you'll find out the right way to get an iodine test and how to supplement with iodine for a fraction of what you'd pay for one medical prescription. All these gifts add up to over $89, so don't be left out. When you click on the big orange button, you can claim these free items just for trying out, risk-free, Dr. Brownstein's Natural Way to Health newsletter for just a few small pennies a day. Now, just ahead, you're about to see why soy is not a health food and could even be hazardous to your thyroid. There's a lot more coming up, so let's get back down to the studio to rejoin Dr. Brownstein.
So when treating someone with hypothyroidism, it's important to take into account other things like iodine deficiency and toxicity, like nitrate toxicity, and to really use a holistic approach. That's the best way to improve a condition that can affect every single cell in the body. Now, there are other things that can inhibit T4 to T3 conversion. Now, soy can cause many thyroid problems. And in regards to soy protein and soy isoflavones, they reduce T4 absorption, they block the conversion of T4 to T3, and they can cause autoimmune thyroid disorders. Soy should be avoided by all infants. There should be no soy formula fed to boys or girls. And in fact, unfermented soy should be avoided by all of us. It's not true that soy is a health food. Soy is a dangerous food for the body. It causes thyroid problems, it causes autoimmune thyroid problems, and it causes mineral and vitamin deficiencies. I diagnose vitamin A deficiency in a vast majority of my patients. And vitamin A modulates thyroid gland metabolism, peripheral metabolism of thyroid hormone, and the production of TSH by the pituitary. The sources of vitamin A are in liver, eggs, and dairy products. They're the most bioavailable source. Plant-based carotenoids provide a poor source of vitamin A. So if you're just going to eat a vegetarian diet, they are not the greatest sources of vitamin A. Now, vitamin A deficiency is a leading cause of worldwide childhood blindness. It can cause severe and minor infections and thyroid disorders, hyperthyroidism, autoimmune thyroid disease, and possibly thyroid cancer. Worldwide, there are over 127 million preschool children and 7.2 million pregnant women who are vitamin A deficient. Part of any holistic workup should include vitamin A levels. Now, iodine deficiency can also cause a decreased T4 to T3 conversion, and I cover that more in my iodine book. But anyone with a thyroid problem deserves their iodine status fully evaluated.
Dr. Brownstein will wrap up his presentation in just a few seconds, so don't go away. In just a short time, the big orange button will pop up and you can claim all your free gifts worth over $89. Here's exactly what you qualify for by watching this video report today. Dr. Brownstein's full-length, uncut video documentary presentation on the unknown shocking epidemic of thyroid disease. His best-selling book, Overcoming Thyroid Disorders, plus a second book from Dr. Brownstein, Iodine, Why You Need It, Why You Can't Live Without It, and a second DVD, Dr. Brownstein's full-length video report on iodine deficiency. And to top it all off, a 3-month trial subscription to the popular Newsmax newsletter, Health Radar. This is a hefty package of stuff. I hope it doesn't hurt your mail carrier's back. So just make sure you click on that big orange button as soon as it comes up, and take us up on our enticing offer to enjoy a risk-free subscription to Dr. Brownstein's Natural Way to Health. By the way, Dr. Brownstein only has one office, and he's not currently accepting new patients. That's why he writes Natural Way to Health each month, to reach people like you all across America. This is a great way for you to get his medical guidance on many important health issues. The big orange button will be live in just a few seconds. While we're waiting on it to appear below this video, here are a couple more things to keep in mind. These professionally produced DVD presentations are suitable for sharing with your own doctor if necessary, especially if you suspect you could have a thyroid or iodine issue, and especially if you've had a TSH test come back marked normal. Okay, it's up. The big orange button is live right now. You may need to scroll down to see it. Go ahead and click the button now to claim your free gifts. Your full-length DVDs on thyroid issues and iodine deficiency, both of Dr. Brownstein's top-notch books, Overcoming Thyroid Disorders, and Iodine, Why You Need It, Why You Can't Live Without It, and your 3-month trial subscription to Health Radar. All of these gifts will be sent directly to your front door when you start your 12-month subscription to Dr. Brownstein's Natural Way to Health for just a few pennies a day. Don't worry, you can come right back here and finish watching Dr. Brownstein's presentation afterwards.
So I'd like to leave you with a quote from Linus Pauling. He said, "Never put your trust in anything but your own intellect. Always think for yourself." I hope I've left you with the ability to think for yourself and to not be considered just a TSH test. Now you are armed with the knowledge that you can go to your doctor and help him make the right diagnosis for you and the right treatment for you. Don't give up if you're not feeling well. There are treatments available for you. Thank you for listening.
Thank you so much for joining us. That was really a jam-packed half hour, wasn't it? Please don't miss out on your opportunity to claim your own free full-length DVD of this presentation, containing about 20 minutes more of deleted scenes, proven research, and additional practical tips and strategies to give you and your loved ones a healthier thyroid and a healthier, happier life. And grab your 2 free books, Overcoming Thyroid Disorders and Iodine, Why You Need It, Why You Can't Live Without It, along with your 2 bonus DVDs on thyroid disorders and iodine deficiency. Don't you think you owe it to yourself to discover all you can about your thyroid and iodine, crucial keys to your optimal health? Here's all you need to do. Click that big orange button below right now and let us send you Dr. Brownstein's Natural Way to Health for mere pennies per day. Your satisfaction is guaranteed, and remember, we have 8 million Newsmax readers and only 2,000 books and DVDs in stock. I'm so sorry, but when they're gone, they're gone. Again, thank you for sharing this eye-opening video documentary presentation on thyroid health with us. You've been a great audience. Thanks for watching, and we'll see you next time.